What's up, everybody? It's David, host of Highway to Health podcast. Had a recent conversation with the CEO of ADEC Innovations. His name is Jim Donovan. He might be the most interesting man in the world. Our conversation was focused on near-term, long-term implications of ESG in healthcare, some things that you can do short-term and long-term to work it into your business in a way that makes sense. And then hopefully providing some education on what's coming in terms of compliance and regulatory concerns. After the conversation, I thought it might be useful to provide a little bit more information on what ADEC does in healthcare. So for those that plan on listening, ADEC Healthcare provides outsourcing solutions that you're really familiar with. Things like utilization management, revenue cycle management, coding, patient engagement solutions. They also help with ESG services. And with ADEC's global presence across 6 different continents, they offer onshore, nearshore, offshore, impact sourcing services so that they can support you in your sustainable growth initiatives, things that you're really familiar with. As a part of the ADEC Innovations Group, the healthcare branch benefits from the overall group's expertise in ESG, supply chain solutions, and helping organizations enhance their social and environmental impact, help improve efficiency, help support long-term growth. You're really familiar with some of the things that ADEC Healthcare does. The ESG sustainability conversation, it's not a new one, but it's one that's less clear than some of these other topics. Our goal with this conversation is to provide some clarity, provide some education, and hopefully give you some insights on how you can start working these initiatives into your business in a way that makes sense, both financially and environmentally. This conversation was fun. It stretched me because it's newer for me. Hopefully you learned something. Hopefully you enjoy. Hey everybody, it's David Kemp. I'm your host of Highway to Health podcast. We appreciate you being here. If you know anything about this podcast, you know it's a passion of mine to unlock the voices of some of the experts around our industry. Those experts that are committed to improving access to care, experience while getting that care, and then outcomes for our patient and provider communities. It might be self-serving, but I've enjoyed learning from the great experts that we get on this show. And when I'm getting that benefit, I hope you are as well. So thank you for tuning in. Today's going to be a fun conversation. We have the CEO of ADEC Innovations. His name's Jim Donovan. And this conversation is going to touch on sustainability in healthcare. Our providers are facing a lot of challenges. Our providers are also being met with a lot of requirements, regulations, and compliance. And that's why I'm excited to have Jim on the show today to talk through those and the possible solutions that are available. Jim, welcome to Highway to Health.
David, it's really great to be here, and thank you very much for having me on your show. And we really hope to contribute a small part to this conversation.
Well, it's an honor to have you, and this is going to be a lot of fun. We're going to talk about business. We're going to talk about healthcare and sustainability, but it's a question that I've grown to really enjoy asking right at the start of each episode, and it's what you do to maintain physical and mental well-being. We have to perform. We have to perform for those closest to us. We have to perform for those colleagues that depend on us, and a healthy habit helps us do that. So I'd like to ask you what you have implemented in your daily routine to stay at the top of your game.
Well, that's a great question, David. And frankly, I travel a lot. Our group operates in 22 different countries, so exercise can sometimes be a challenge. But in essence, the one thing that I try to always pack is a pair of sneakers, and I try to take them everywhere I go. And to be frank, is just getting in some steps, and whether that's trying to start the day a bit earlier or in between calls, I basically try to get in steps. That's first and foremost on the physical side. Mental is really, I guess that could be up to question for your audience, but really trying to take in different aspects, and I try to bring in and read different subjects, just to basically try to feed something different into the machine. And so we participate in a lot of different aspects, from NGOs to UN events. But we try to basically keep it fresh. So that's on the physical and mental side.
Travel is always good for the soul too. Getting to see new places, explore new cities, and getting out on a walk or a run. Great way to do that. What's your favorite place? Where do you enjoy taking
a walk or a run the most?
There's so many good places and people around the globe. Sometimes it comes down to the season, frankly. But for right now, I'm just in a small country called Malta. I'm actually heading back to the States, and I've just come from the Middle East. So I've experienced many different weather conditions. So I can't really say there's one favorite. I would say it's really about the people I get to meet, and in whether that's in operations or just in just day-to-day meeting is fantastic.
Yeah, I can imagine. I do enjoy traveling and just learning about new cultures, and so what a great way to do that. You now you're a military man, right? And I come from a military family, and so first of all, thank you for your service, and I'd like to ask you how that military experience has helped, you as a leader, and also how it's helped implement a really strong culture that you guys have at ADEC.
Well, first of all, I was very fortunate to be part of the Marine Corps back in the early '80s, and one of the experiences that taught me was, frankly, perseverance, and faced with different situations, focusing on the mission and persevering has been not only part of our training but brought into the company. And we've been blessed. We've been blessed along the journey, not just while in the service, but through our corporate experiences in being able to build a company. And it really comes down to teamwork. None of us are here today without a village bringing us here and the team that a lot of people don't see. So I would say it taught me the value of teamwork. A mission is better and more successfully accomplished if you work successfully with your team and live and breathe it. And frankly, ADEC wouldn't be here without the team that has brought it on its journey over the last 27 years.
I'm a big sports guy. I come from a military family, like I said, and the one thing that's common about those two areas is teamwork and being a part of something larger than yourself. And the military, in my experience, is the perfect example of putting others first. And it's not about you. And I see that in the culture at ADEC from the stories of your team and some things that I've heard about you leading up to our conversation today. And so teamwork's a big one. Resourcefulness is also one that I've learned from my family that has military experience. Finding a solution when it's not obvious, and doing the work. And if you don't mind, if I'm not putting you on the spot too much, tell us a little bit about how resourcefulness has played a role in the ADEC culture.
I'm not sure we would be anywhere, because when you start any business, you start with some reaching ideas. And in my case, my partner, myself, Carol Oscara, and myself started with one laptop and a portable printer, and great aspirations. So, frankly, we were able to tap into many years ago into the capability of the Philippines. And while it is very evident today, it wasn't so evident back then. Frankly, India, there was only one path, and it was called India. That was the road. And the Philippines was really not on the map per se on the call center side, and had very limited back office that was pretty much just shared service from Citibank and AIG. So I think, I'm not so sure it's resourcefulness or it's connecting the dots and then being able to sort of continue to evolve that value proposition of the Philippines. And we were frankly beneficiaries of that journey. As the Philippines grew, so did ADEC. And then we also then branched out around the world to be more of we're a rare duck that we grew to be a multinational, but from offshore back to onshore. So resourcefulness, I would really say, is just about leveraging the different assets that you have that may not necessarily be as clear at that very moment. And sometimes, frankly, you get it wrong, and you make adjustments and figure out a way to go forward. And that's not me. That's just also all the people that have been on the journey with us.
And I think resourcefulness and innovation are one and the same. And innovations is in your name, and so it's almost foundational to what you guys are doing at ADEC, at least from an outsider's perspective. So you're also passionate about environmental sustainability. Where does this passion come from?
David, we grew a business to a certain size, and I want to say back in 2008 or so, we saw that you get to a point that you're like, how could you use your capabilities? And frankly, we moved data. We managed data, we delivered value propositions that help businesses be more efficient. And we started looking at what was happening in the overall sustainability or the nascent sustainability field. And we realized that, frankly, everyone was going to have to move their business models to a different state. And for that, there was going to have to be a lot of data that was needed to hopefully make better decisions. So our journey, our excitement about the environment or sustainability really came from, can we play some catalytic role? Can we play a catalytic role that can help at least give people enough information, a window into how they could possibly create value by making positive changes? Now, again, that's the bright eyes of an entrepreneur seeing what's possible. Now, through 1 or 2 years, maybe more, on the journey, we've also had to evolve our understanding of how to create value propositions, how to be at the table, understanding that not just the politics, but the timing. And, we're in a world where you've got global conflict, you've got inflation, you've got so many things dragging for the people's attention or wallet share. So how do we create value? So our interest was as much trying to leverage our capability to help people make better decisions. But in doing so, we also learned a lot along the way. And that's, in essence, what we did. I mean, obviously, the world has got a heck of a lot of disruptions going on, more than I can speak on this podcast. But I think as the world evolves, and we do believe it is, the only way to thrive is evolve with it. And that's what we believe in is, and not to be too dire, but time is getting short. And, there is a window where there's going to be 10 billion people in the world.
Right.
And what we need to do is bring people along a journey to move as fast as we possibly can to a better state. And I'll end this question you had with this. Ironically, the technology exists, David, and the money exists. What doesn't exist right now is the political will and the bankability of broad projects to absorb, or the capability for projects to absorb the capital. So I can't do anything about necessarily the political side of that equation, but we try to work on helping drive data so that projects can absorb capital that can participate in better end results.
Yeah.
Long answer, sorry.
No, controlling what you can control, but understanding the different variables is a big piece to this. You talked about, this isn't a doom and gloom podcast, but I do like to set at least some sort of frame of context or relevance for the listeners. Tell us, in your opinion, without mitigation, without a change in direction, what kind of impact could we see on our population's health?
Oh, well, first, we're all part of somebody's supply chain. And meaning there just is, if one country has a carbon footprint of this or that, at some point, we all live on the same planet. So what we're really talking about is dramatic changes in weather. And it isn't necessarily warming, it's just severe weather, which includes flooding, which what happens is you're moving the weather zones, the weather bands around, so you all of a sudden have tropic diseases shifting areas. You then have the floods cutting off certain communities. You have other environmental impacts that are starting to happen in places that we've never seen. So health is at the cutting edge, is really, I hate to use the term, but at the coalface of these societal challenges, because frankly, they're out there every day trying to do their job of serving society in the best way that they can. And we're adding to their plate, almost not from left field, but, giving them more unsustainable, and not the budget to handle it either.
Right.
The capability to have wellness in a population, it goes well beyond. I mean, I think with COVID, as a real example, no one really thought of the psychological challenges that came with COVID. Right. That was sort of, and it's still with society today. So there's just so many aspects that healthcare is at the real sort of face of these challenges. And we believe sustainability, while healthcare has budgetary issues, challenges in managing their sprawling resources, implementing new technologies. Sustainability is going to be part of how they make better decisions and how that they further have a better impact across their community.
I agree. I mean, and you mentioned this earlier, sustainability is at the core of our healthcare organizations because it's directly tied to the health and well-being of our population, of our community. And I know ADEC works in many different industries, not just healthcare, but healthcare has this bad rap of being 10 years behind every other industry, slow to adapt, slow to evolve. There's some reasons for that healthcare has inherently built into the system, into the structure that other industries don't have. But in your experience and in your opinion, what are some of the main challenges that prevent or delay these healthcare organizations from implementing some of these sustainability initiatives?
Hey, that's a great question. The challenges, are not just for healthcare, to be frank. They cut across a lot of different industries, and some of it is the knowledge, timing, budget, getting the data. These are top barriers. And again, they're not just for health. Every industry. I think health is in such more of a challenge because the budgets are so razor thin. In running hospital facilities, they are on just a razor edge of trying to manage facilities, deliver services, and fight for their billings. So my answer would be obviously knowledge, and the challenges of, you've got two things. You've got the regulatory side and you got the voluntary side. Right now, regulatory, do business, do this or not do business. But more and more these voluntary standards that are being put up as North Stars, it's a challenge for a healthcare organization to look at them and try to identify how much resources are they going to put to that. Mm-hmm. But knowing that they're going to, how to take enough steps, but not so much that they're taken away from other critical budgets. And it's a balance. And to be very frank, that's where we end up working with organizations to help them find that balance. And also, number one is how can they build a value proposition into their supply chain? How do they get value from whatever steps that they take, that they get clear value from it? And it's not just a piece of paper or certificate to hang on the wall. I think those are good, but I think bringing real value that CFOs, CEOs, chief risk officers can understand and value so that it just doesn't go away the next time there's a budget cut or rearranging of where the money's going. Yeah.
I mean, the budget conversation in healthcare is one that you have to have, and it has to be a lot of times it has to be an economical, purchase or discussion to make a move. If there's no margin, they don't have a mission, and sometimes these providers are working on such tight budgets like you described that are razor thin in terms of margins. They have to focus on the immediate or the urgent and not necessarily what they even understand already as the more important, but more long-term. And I imagine that's a tough balance and a tough conversation.
It is. And I think, as a provider, a professional in this industry, I think it's on us to do a better job instead of just saying, here it is, that's it, is to try to help walk them down the aisle of what is possible today and in the near term that will then open up the possibility of the next value creation, because it's a bloody journey. There is no light switch. If there is, I haven't found it. It's healthcare. First, healthcare is undergoing such a challenge all by itself. In its how it's going to deliver healthcare in the future is totally different than how it's doing it today. More than likely, your home will be outfitted with more gadgets in the future than the current hospital room, and your own residency will become an extension of that ecosystem. So healthcare is just grasping with its whole value proposition and how that's quickly changing with technology. And then here comes along this, by the way, you need to be more sustainable. Yes.
Yeah. Yeah, exactly. Yes. But maybe, some of the transformational changes we're seeing in healthcare right now, like, these non-traditional places of care like the home, while they're making that shift, maybe it's the perfect time to be having conversations around, now, okay, this is the shift, this is the transformation that's happening. How can we do it the most sustainably first instead of having to fix it later? Maybe
Correct.
That's an opportunity.
It is. Any time a new situation's being put in, the reality is it's the best time to look at it and put in best practices as we know today. Think about this, David. All supply chains are really under review. And when you think about it, every person, whether they're providing a service or a remote nurse or a clinic that's a part of a satellite organization, they're all part of an ecosystem. And they need to now not only track their energy and water and waste and pretty soon recyclable plastic and virgin plastic and chemicals. The list is just growing, and where is PFAS in the supply chain? And we know it's there, and how do we manage that? So more and more this is going to be stacked up. So the organization that gets in front of how to do this, adding these additional needs on as time goes by, will be a lot easier than it will be to say, okay, we're going to tackle this in the next quarter or the next budget year, versus taking it one step at a time and sort of just start. If I could leave any message, is just start the journey and make sense as you go forward.
So maybe it would be a good time to talk about or discuss, because I probably see this as short-term versus long-term, right? What are some of the most, so let's break it down in that way. What are some of the most immediate actions those in healthcare can start taking to see some short-term success and positive direction? And then we'll talk about long-term here in a minute. But if we were to think about short-term levers that we could start pulling right now, what comes to mind for you?
The short-term levers is manage what we have. What is the gap analysis so that we understand? Very, very often, a lot of this sounds, sort of hairy-fairy, versus invest in a gap analysis. And we're not talking nothing against the Big Four or any large consulting shop, but really an engineer can give a gap analysis. Understand where you are today, because then you can make appropriate plans on what is the steps forward.
And then, which I've got a question about, how important data is and the management of that data, the quality of that data. I'm going to come back to that. But talk about long-term. So if short-term is gap analysis and kind of getting a state of the union, based on that analysis, the answer is going to change. But what are some of the big levers that we pull for long-term improvement and change?
So sustainable infrastructure is going to be key. The whole infrastructure, frankly, even as we speak, more money has been allocated to infrastructure sustainability than ever in the United States' history. So we don't see that healthcare is going to be left behind. More and more investments are going to be placed into sustainable infrastructure. And what does that mean? It means more remote patient care. It means green hospitals. It means renewable energy sources, incorporating sustainable materials. It's across the spectrum. And the idea is to have sustainable, innovative healthcare delivery. And that's key. So short-term gap analysis, where are you today? And then make really basic decisions about how fast do you want to go on this journey and what makes sense. Sustainable infrastructure is going to be the medium to long-term goal for all of us.
So as a member of the healthcare space for the last 13 years, the biggest challenge is data. Getting good data, managing that data, ensuring the quality and accuracy of that data. Tell us a little bit about, you talked about how, there's a couple different ways to do this gap analysis, maybe an outside consultancy or an engineer internally or something else. Talk a little bit about how important and what kind of role the data management, the quality of that data plays in understanding the road ahead, the path ahead, the journey ahead for, each one of these organizations.
Data management, analytics, I cannot understate, play such a crucial role in sustainable action plans. They give the necessary insights and tools to drive the best decision making and measure progress. It really, you can write a lot of narratives around sustainability, but when you drive the numbers and show that it does create value, it makes a world of difference. It helps an organization understand environmental impact, identify areas for improvement, and make evidence-based decisions. That's really the key. The quality of data is the basic building block, that basic Lego, but it has to fit into a plan.
And that plan, you talked about tangible results. That plan has to lead to tangible results for these healthcare organizations because of those razor thin margins. What kind of information are they looking for? Right, we're in this. I'm in this space here at MarketScale where we're trying to help organizations educate and engage their community, right? And by that I mean teach their employees, their customers, their partners something new, and help them find success through that education, through that engagement. That's got to be a huge, important part of this journey in the healthcare space for ADEC, because a lot of times these organizations don't understand the opportunity that's there. They also may not even understand the regulatory mandates that are being passed down to them. How important is that education for ADEC for your community, and how maybe are you going about educating the partners, the customers, the prospects?
It's a great question. We've spent quite a lot of time in the educational side, and still do. So first, I'd say understanding every industry and even every corporation is on a certain level of the maturity curve, and understanding where they are. If you've got a distressed organization, they're obviously trying to figure out ways to keep the lights on.
Exactly.
So I would say helping them understand, what are the current compliance issues, what's coming over the horizon, and how they can best interpret it and execute them with often the tools and systems they have. As you know, with your experience in healthcare, data resides in so many different buckets. And it's almost criminal the way that it's kept separate. But to be able to gather that up and integrate it, as a business, we absolutely believed education is so important. It's vital in building those capacities. To be frank, as a corporation, we believe in it. Part of our organization is actually we have a 100-year-old university as part of ADEC. That's actually the oldest part of our organization.
Wow.
In addition to that, we also, through our NGO efforts called Global CO Alliance, we partnered with the UN And we run a capacity building arm called CFEL, and it's part of there's 31 CFELs around the world, and we provide education to member states for best practices. So we not only believe in it, but we live and breathe it, because if you're going to be helping people on the journey, you also have to be helping them with the information. So we believe the healthcare, they've just got so much on their plate. We know that there's some of the brightest and best practitioners in the space in their various vertical. Sustainability has a bit of a blur, because it's like, well, it can cover, does that belong to facilities? Does it belong to a board of director? Does it belong to, the reality is it's all over the place. So we believe our role is to help educate in some way part of this journey on how health organizations can undertake this journey without, setting up for, we're climbing Mount Everest next week. That's not realistic, and it's also not sustainable. No pun intended. This is about going through the best practices, understanding what framework is right for that organization. There's plenty of frameworks, by the way. The world is not short of frameworks and acronyms.
That's true, especially in healthcare. Yeah.
And we're not trying to add more, but the reality is there are some very good best practices out there that can be brought in, and without reinventing the wheel, and doing it cost effective and bringing an organization on the journey. The challenge is going to be more and more federal contracts, insurance carriers are going to start requiring things that health systems were not familiar with. Because it is, for them, it's going to seem like it's coming out of left field, but these are things that we see coming through the pipeline, and pretty soon they're going to be part of the contracts that are out there. And so really you could say sustainability is part of contract risk mitigation. And you'd be right. And we need to help the medical facilities operators understand, and whether you're a provider or you're providing the actual services, what part of that ecosystem are you, and how is it going to affect your delivery, and also the visibility you need to provide your stakeholders and ecosystem.
Yeah, it's coming, and so you may as well know as much as you can about it, have a partner that can guide you through it, and find success on the other side of it. But still, I mean, when I think about the different geographical, governmental, financial variables that you have to account for when building out these plans, I bet flexibility has to be a huge part of your offering. And how do you do that at scale? I mean, you're a huge company. How do you provide flexibility at scale without, just creating a novel solution every time?
The good news is there's lots of guiding frameworks and principles, as I said. It's really helping the client understand materiality in that journey, that yes, they're special, but understanding their materiality, what matters to them, and having that assessment, and then basically what is the approach after that. So sustainable initiatives must be intentional and fit for purpose to be impactful. And if that sounds so simple, and it sounds like, yes, of course, it should come out of a fortune cookie. But in actuality, to try to understand, to say, okay, material, if you're running, a facility with whatever, 100 clinics and, X geographic, the reality of your location and the population you're serving is going to dictate a lot of what you think you're going to do. But if you happen to be, let's say, in flood zones, all of a sudden, extreme weather and potential impact of, let's say, electrical delivery to you is going to become more impactful. So materiality, all of a sudden, or wind shear, let's say, these are material impacts. Now, you may not be able to pick up your facility, but you might want to start thinking about disaster planning on how you're going to manage that, or at least understand that you don't have a plan right now and you're going to get one.
And so to me, it sounds like the flexibility comes from the data and understanding, the specifics of the need around, each organization. And then from there can come a tailored solution.
It does. And I'll give you, in this has happened several times with large floods in Houston. One of the aspects that wasn't planned for is a lot of this bad environmental things, were historically very static because they just sort of stayed in the ground or stayed on or near. No one ever expected X flood to come and start moving things around. So all of a sudden you have a different environmental impact and sustainable picture and a different exposure to the population and different healthcare and different health risks. So understanding that, as times change, that data can help us make better decisions in more real-time basis.
And that's what's needed. And as long as that data, and you talked about the different silos that these data sets live in, but if we can bring it together and make really clear understanding of those needs, then the path forward for each one of these organizations should be clear, and we could define short-term, long-term steps to find success. We've talked about a lot, and I'd like you to leave our listeners with one thing, that they could walk away from. If there was one thing that they remember from our conversation today, what would that be?
Make sure you come back and listen to David's podcast or the next podcast. That's the first thing. Next is, first of all, it's great. Thank you for this invitation and being here. What small part we can help or hopefully lead people with is, we believe the industry, the healthcare industry, is not about just treating illnesses. It's about promoting overall well-being, ensuring a healthy future for generations to come. ADEC's commitment for sustainable practices is not just about improving one facility. It's really about being part of the journey of these different industries we're involved in. So we believe that if healthcare can improve patient care, it can also enhance resiliency in our communities, in our environment, and therefore our health systems. Looking ahead, I believe our biggest lever is going to be investing in sustainable infrastructure and supporting environmental stewardship within our organizations. Education, awareness is key. And I really believe that, let us remember that, whatever we do, each and every one of us leaves a footprint on tomorrow. And it is our responsibility to ensure that this footprint is a positive footprint. And I know that, that's not trying to be, telling preachy to anyone, but we all have a part to play, and I think we all can do better. So by working together, we can build a sustainable healthcare system and community that not only meets the needs of the present and safeguards the health and well-being for future generations. And David, thank you very much for this opportunity to speak to your community. And we really appreciate it. And if there's anything we could ever do, please let us know.
Well, thank you for being here. And you said it best. I use the term all the time. It's going to take a village, and everybody's got to do their part. And so thank you for being here. This was a fun conversation and something I can continue to learn about. So good luck to you guys and everything that ADEC is a part of.